Mohammed Smadi. I'm sorry for this mistake.
Not a problem.
Uh, okay, Mr. Mohammed Smadi is the managing director of the Penguin, where he leads the business and technical development of opportunistic managed indoor positioning solutions. Prior to Penguin, Mohammed founded Karmatics, a telematics-based loyalty program where he coined the term road as a service. Before Karmatics, Mohammed was a principal researcher at BlackBerry driving quality of experience over Wi-Fi. Mohammed is also the co-founder of Ergo Wi-Fi, technology provider for solar-powered Wi-Fi mesh access points. Mohammed holds more than 25 granted pending patents in addition to authoring several refereed papers and book chapters. Mohammed has a PhD, MA of Science and a Bachelor's of Engineering Management from McMaster University, ECE, where he's currently an adjunct assistant professor. Thank you so much for joining us.
Okay, well, I think my assistant did too much of a job adding that mouthful introduction. I didn't realize it was that long.
I think you did a lot.
Well, thanks for having me, and it's really a difficult path to follow after Martha. It's a fantastic speech by her, a fantastic presentation by her.
Mm-hmm.
It was really a pleasure and very educational for me. So perhaps today we're somewhat different than the rest of the folks in the panels and the speakers, as I don't come from a medical background, and as you said, I'm an engineer by profession, and we're focused really at the digital realm. We're trying to create enablement tools to allow healthcare professionals who are very thinly stretched to do their jobs better, particularly to deliver better patient experience. And that's what we've been focused on at PenguinIN. I'm going to share a slide, a few slides. Okay. It can. Are my slides clear?
We cannot see them yet.
Okay. Let me just make sure that it's share screen. Okay. Are they now?
Now we can see them. Yep.
Yeah, beautiful. So basically, there are many areas of digital transformation in healthcare. Today, you can consider digital transformation as part of the electronic medical records, smart watches, telemedicine, artificial intelligence, and digitally enabled medical devices. We chose to focus on smart building technology and support the medical practitioners by allowing their environment to be smarter and to improve their efficiency and add additional performance in the healthcare sector digitally. And you know, there is an expectation today that there is a digital parallel to the being. There is a digital parallel to the environment. There is a digital parallel to the physician. There is a digital parallel to the file. And many smartphone users expect to consume information digitally. And as a matter of fact, if we look at the statistics, even though some of this is outdated, you notice 87% of hospital physicians use a computer or a mobile device during a patient visit. So there is an expectation by both patients and practitioners that hospitals will extend and enable their digital experience. And this is where PenguinIN comes in. This is where we try to add intelligence to help patients and staff to do things better, to interact better. From the previous presentation, Martha talked about communication, teamwork. She introduced the concept of cards about patients and about physicians, so patients would get to know their treating physicians better. All this can be digitally enabled and cheaply and digitally enabled when compared to classical and traditional mediums. Some of the challenges that we have been trying to address is look at misappointments. Like the U.S. healthcare, it's $150 billion per annum. Like people at a cost of $200 per per missed appointment. That's a significant fraction. And people don't realize how the reasons necessarily behind why missed appointments are, but a lot of these missed appointments happen because people miss their wayfinding. They arrive at a large medical city and they're unable to identify the clinic or the physician that they're expected to see. Another challenge is to look at missed equipment. 1/3 of nurses spend an hour or more per shift trying to find medical equipment. So the solution that we will be talking about today is indoor wayfinding and indoor asset and staff and resource management and identification. Where can I find that wheelchair? Where can I find that IV pump? I arrive at a medical city and I parked my car. Which building am I supposed to go to and how am I supposed to go there? And we really capture those into like an outpatient clinic. We took the Saudi Arabian Press-Ghani report and tried to create journeys out of that. So if Ali is a patient and his pain point starts by, I keep missing my appointments and not knowing what to bring, our platform would allow reminders, automated reminders to send Ali a notification the night before. Okay, you need to be fasting 12 hours before you show up. And you need to bring XYZ with you. So Ali arrives. It's a bit difficult to get to the closest entrance by shuttle or bus. Well, Ali requests valet service perhaps, or Ali drives, the Uber driver or the Korean driver finds them the closest parking spot where they can drop them off. While Ali is waiting for his turn, he's bored. So once he checks in with the triage nurse, Ali can get some quote-unquote infotainment messaging that is about his medical condition. These are real-time notifications that are catering to his particular appointment and to help him get better education before he sees his physician. I struggle to find the lab, the pharmacy, the bathroom in this place. We provide a wayfinding tool with very much like GPS outdoors, but it's indoors with turn-by-turn instructions. Turn right, turn left, you've arrived at your destination. Surveys is one big thing. The bathroom, we found that in many facilities, the bathroom cleanliness is not, up to standards. So Ali goes to use the bathroom, they leave we detect their location. As they leave, we give them on the mobile application for that healthcare facility, we give them the option to complete a survey. The answer or the completion of that survey, depending on the answer, could trigger the facility, could be sent as a notification to the facility manager saying that particular bathroom needs some attention. There are some business rules built in. Then Ali goes to collect his medication after waiting in the long pharmacy queue. The pharmacist told me that my medication aren't even available. So why should I have waited, right? So we could have queue optimization. First of all, saying how long people typically wait at a particular queue, put that in an analytics format that decision makers can consume. And then perhaps if that medication, if that app is linked to the inventory and he didn't have to wait all that long, and then he leaves and he can't find where he parked. I mean, we're talking about people who are patients, they're tired, they're fatigued, they're exhausted, they park their car, they leave the facility 2 hours later. Where did I park my car? We provided with a car finder. So you parked your car in a particular parking lot. We pinned that and we got you right back to it. So I go home and surprisingly, my visit hospital was pretty good today. I need to tell somebody about it. Instead of waiting for the Press-Ghani personnel to give them a call later, I have this tool right at my fingertips where I can report back on the issues that I really liked or I really didn't like, and somebody else will be able to look at that data and use it. All this is fine and dandy, but there continues to be challenges for the digital realm, specifically mobile applications, because many of these nice, if you want to call them solutions and or features, require a mobile app that integrates with so many systems. For example, if the mobile app is responsible about informing and or reminding you about your appointment. It needs, that mobile application needs to be integrated with the appointment scheduling system. And to that extent, healthcare practitioners or healthcare facility managers or patient experience managers more specifically need to be aware of the integration challenges when they choose the partners that they work with. Additionally, there is something called an app fatigue. Every one of us has tens, if not hundreds of apps. Why do I need that particular app for that healthcare facility? There needs to be enough value in that app in order to merit for a patient or a staff to have it installed. And some of the key challenges with digital in general is digital system upkeep. 2 years after the installation, is this system still fully functional? If we're installing a patient or an equipment tracking system, is the accuracy still up there? There is a rather interesting paper that discusses one of the RTLS platforms that's pretty famous that says a lot of these platforms get orphaned after 6 months because the accuracy isn't there. The initial promise isn't really delivered long after the installation. I just want to touch on a case study that will show a sample return on investment. Usually, patient experience, and more specifically, digital patient experience, is hard to quantify. And if it's hard to quantify, then it's hard to build a budget for. So we're working with one of the major healthcare facilities in KSA. I'm talking to their CIO. He says 23% of my patients miss their appointments. And that's roughly 80,000 missed appointments per month. And a conservative estimate, 20%, which is almost roughly 16,000 visits, can be saved by deploying a wayfinding solution. He says people show up, they park their car. It's such a huge medical facility, a medical city actually. They don't know where to go. And they're taxing the staff by asking them where to go, right? Can we deploy, his question was, can we deploy an indoor navigation solution? They already have an app. The app has a fantastic adoption. The patients consume their medical records on it, and they can book appointments through it. So can we use that app? And the challenge was, can they use the app to do indoor navigation? And the expected outcome is to improve service quality by reducing wait time. The patient doesn't need to wait. The patient is aware that the nurse or the triage nurse or the physician, they're aware that the patient is on site. Increase timely appointment show-ups by ensuring patients don't get lost nor arrive late, and reduce crowd and congestion. Basically, if patients are informed when to show up, and we have a better ability to control the crowd and a better ability to estimate our wait times, that's better for everybody. And these are just a sample of the things that we do at PenguinIN in terms of driving and articulating that patient experience digitally. Thank you very much.
Thank you. Thank you so much for this very interesting presentation. We've learned a lot about these digital systems and apps. And actually, there are two questions coming from the audience. The first one is, what advice you have for a hospital who is looking forward moving to a smart hospital journey?
I think basically have a digital expert residing in your committee who can guide can basically articulate surveys and a vision to the patients in order for them to help the patient experience committee prioritize their digital solutions or digital requests, because we may think we know what the patient wants or what the staff want, but unless there is an expert there to articulate that clearly and guide them, you'll be surprised at the answers. A lot of times people think they know what the patient wants or what their colleagues want digitally, and that's vastly different from the actual needs or wants.
You're right. You're right. That's why we need to learn about patients reactions, patients' insights. And the second question is it acceptable to make a huge change to any service on one opinion only?
So I think that's, in my humble opinion, I think that's the recipe for failure.
Mm-hmm.
Right? I mean, you need, it's no one person, unless you're Steve Jobs, and even then, but no one person really knows everything, right? And you just surveys are meant for a reason, and patient experience is patient experience. It has to be driven by the patient voice.
Yeah, you're right. So I guess we are at the end of the questions, and I would like to thank you for your participation and your presentation.
Thank you very much for having me.
Thank you. Thank you so much. So we are at the end of the first day in our program of the Patient Experience Excellence Congress. Zanab, I will be doing the closing remarks.
Yes.
If it's convenient. Yeah. After the opening, we were we had Dr. Adeline Saliba from SEHA, the Abu Dhabi Health Services Company, and we were able to learn about their approach to patient experience, and during the COVID-19 time, what precautions they were able to take in United Arab Emirates. Then we had our panel, and in our panel discussion, we had 5 participants. Michel Atala from Siemens, Dr. Abdullah Al-Hawsawi, former Director General of Saudi Patient Safety Center, Dr. Metab Al-Bugami, VP Healthcare Delivery, and Dr. Matu Sasidhar, Chief Medical Officer of Cleveland Clinic, Abu Dhabi, and last of all, Iman Al-Turaiki, Director General for Patient Experience. And we had a great discussion about what is really happening about patient experience and staff experience as well during the COVID-19 time. And we were able to answer many questions during the panel session for 1 hour. And then I had the opportunity to talk about the family presence guidelines that Planetree within a coalition created. And I was able to talk about the 8 guiding elements in this guideline. Afterwards, we were listening the patient experience in emergency unit and beyond from Dr. Ahmed Mahmoud Wazan, and he was able to take us into the emergency services world and make the difference between what is it so different from the outpatient clinics or the inpatient clinics, inpatient units of a hospital. And then we heard about a case study about patient experience in transplant centers from Dr. Metab Al-Bugami, especially for the patient experience of the pre-transplant patients, the selection process, and so on. And then we were able to hear Alan Dubovsky's remarks about Cedars-Sinai Hospital, and in the last 4 years, how they were able to create a patient experience office and a program in their hospital. Then Marta Parra, the Vice President of Clinical Support Services in Children's National Health System, talked about their journey in Children's National Health System and what they were doing from the point of patient safety as well as from the point of patient experience. And last of all, we had Mohammed Smadi from Penguin telling us about the systems the digital systems that facilitate the life of patients when they are coming to the hospitals. Coming to the end of our session today, I would like to thank you for your participation, for your patience, for your interest in the subject matter, and I hope to see you tomorrow with the new sessions. Zainab?
Great. Thank you very much, everybody, for joining us. Thanks a lot, Ilke, for moderating and sharing today's sessions and making it absolutely engaging, worthwhile, and interactive for the audience to take benefit from it. I hope you all enjoyed your session today. We look forward to welcoming you back again tomorrow and day after to a very exciting program that we have in store for all of you. Until then, it's goodbye and stay safe. And we look forward to seeing you back again tomorrow.
Bye-bye.